rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland and the rest of the world with our safe, secure, fast and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's money transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
It's been a very important day again in the calendar of the Minister of Health and the Government of the Gambia, where we are witnessing the arrival of 25 remaining ambulances out of the 80. You remember when we did the formal, the first handing over by His Excellency the President, somewhere in Banjul, and then the Minister, Honorable Minister of Health, also mention that there are 25 more ambulances that are coming, and today this is what we are seeing here today. These are the ambulances that the Minister promised to deliver to the communities of the Gambia to ease the burden of transportation, especially those who are supposed to travel referred from one level to the other. So this is a very important day for us, and we are happy to be here. And then I now invite the Permanent Secretary PS Damfa, to give a welcome statement on this. Is that all right? No, just one, two, please.
Ladies and gentlemen, I want to take this opportunity to welcome all of you to this handing over of the 25 ambulances. As Ms. Anjay has rightly said, we purchased 80 ambulances. We've received 55 ambulances so far, and the remaining 25 ambulances, those are the ones that have just arrived, and the Minister is here to receive them from UNOPS. The procurement process was done by UNOPS, but was 100% financed by Government of the Gambia. It's not financed by any donor, but the Government of the Gambia resources. That was what was used to finance the 80 ambulances for the various communities of the Gambia. These ambulances are procured mainly communities that are far from the facilities, and they are also hard to reach communities. We want to take that opportunity to thank UNOPS for the support that they have provided to the Ministry in terms of the procurement process. That's the UN agency that has provided the procurement services, and they got us all these ambulances. And we want to thank them once again for the services that they provided. And now we want to invite the Minister just to make a short statement before we do the handing over.
First of all, we are really happy to receive all of you guys today in our premises on the final phase of the delivery of 80 ambulances. The collaboration started months ago between the Ministry, UNOPS, and CFAO. Here we are today delivering the final 25 units. On behalf of the management and staff of CFAO, we wish to thank UNOPS, Ministry of Health, and the Government of the Gambia. Thank you very much.
Thank you. UNOPS, and then from there, he will hand over the keys to the Honorable Minister, who will receive the keys and now also make a statement. Abdullah, welcome.
Honorable Minister of Health, the Permanent Secretary, and the officials from the Ministry of Health, the staff of SafeHouse, who have been very supportive of this initiative since we began, and members of the press, good afternoon. On behalf of the United Nations Office for Project Services, we're very delighted to enter into partnership with the Ministry of Health to support the procurement of these ambulances, which we believe would immensely help to bridge that gap between local communities and access to health services in local communities that are hard to reach. This is the final phase of 4 handovers that we've done in the past. We've already handed over 55 ambulances in the past from late last year. And today we're here to witness the handover of the final batch of ambulances to the Ministry of Health. We as a UN agency, we're very delighted to support the government of the Gambia. And to clarify, the government of the Gambia provided financing for this procurement. We, as a United Nations procurement agency, facilitated the procurement through our systems and our networks around the world. I want to thank the ministry, to the government of the Gambia, for trusting us with this project, and also to thank Safe Hour for always being available to process these ambulances when they arrive in the country, and to everyone involved in this project since the beginning. We are immensely delighted to be part of this great initiative for the government of the Gambia. And on that note, we want to thank everybody for their presence here and wish you a good rest of the day. Thank you very much.
Now you can get a different one.
Yeah.
At the back. I see your point.
Yeah.
Good. Thank you. Yeah. Thank you. Thank you very much. Yeah. Thank you. Yeah, thank you.
So the Honorable Minister of Health, Honorable Lamin Samate, who will now come to give a statement after receiving the keys, and now will tell you what the ambulance where they'll be going, the purposes, and we all know the purpose, very important purpose they're going to serve in the communities. So he's going to elaborate on that. Honorable Minister, you are most welcome to the podium to give a statement.
Thank you. Thank you very much, Ms. Sanjay. Distinguished ladies and gentlemen, we are delighted once again to stand in front of you here to receive these ambulances that were procured for the government of the Gambia, by the government of the Gambia, but the procurement process was carried out by UNOPS, which is a United Nations agency. And as we said earlier, it's an agency that facilitates quite a lot of activities for governments and other entities. But the procurement, the funding was 100% Gambia government funded. We keep on emphasizing that. I think this is a culmination of the efforts that have been put in place by numerous team players. But I think we start by giving you the vision of the government of His Excellency President Adama Barrow. Since coming into office, he has put healthcare delivery, quality healthcare delivery to the people of this country, in fact, his topmost priority. The president and government recognizes the importance of having a healthy population for national development. Without a healthy population, we cannot think of farming. We cannot think of any activity of development. So having a healthy population is critical. In fact, investing in health is actually investing in the development of a country. Recognizing these facts and putting into cognizance the challenging health sector we inherited, the challenges in the health sector with dilapidated infrastructure, obsolete equipment, unavailability of supplies, the government sat down and re-strategized. And the strategies are being implemented in 4 areas. One of the areas is to try to get health care to the doorsteps of the people. By so doing, the government has embarked upon construction of new health centers across the length and breadth of this country, construction of new health posts across the length and breadth of this country, construction of an emergency treatment center at Farato, which marks the beginning of the construction of the 1,500-bed teaching hospital, construction of 8 COVID-19 treatment centers across the length and breadth of this country, construction and renovation, upgrading of the Ndeban Health Facility in Bakau to serve as COVID treatment center, expansion, renovation, and upgrading of the polyclinic in Banjul, expansion, renovation, and upgrading of the Edward Francis Small Teaching Hospital, and series of other activities of expansion and renovation across the length and breadth of this country. This is to improve on the services that are being delivered to the people of this country. This is the first step. The second step is the procurement of equipment, because you can have the structures, but you need the equipment, you need the tools to make sure that the services that are needed are provided. The government of the Gambia and partners have already spent over $500 million on the procurement of life-saving equipment to the health facilities of this country. Never before in the history of this country has such a thing happened, and that has happened. Ensuring that there is consistent flow of drugs, medications, and consumables to the health facilities of this country. The government has increased the drug budget. When His Excellency came into office 5 years ago, what was being spent or what was being earmarked on the procurement of drugs was not more than $60 million, and unfortunately, not all that was even spent. But currently, the government is spending over $200 million on the procurement of drugs and consumables for the health sector of this country. That's a remarkable plus. But with all that, you need the people who are going to do the work. So we are training the workforce. We are training the public health officers, the nurses, the doctors. They are specializing. We are increasing the nursing schools. We are increasing the schools for pharmacy. A school of dentistry has started in this country now. We will soon start, inshallah, a school of pharmacy in this country. We are doing postgraduate training. Doctors are specializing now in obstetrics and gynecology, surgery, pediatrics, family medicine, and so on and so forth. So a lot is happening in the health sector. But when the president went round to talk to the people of this country to know their challenges, one issue that was topmost was access to the health facilities. You can build health facilities, but you need roads for people to get to the health facilities. You need vehicles for people to get to the health facilities. We were somewhere up country, and we had horrific stories. A traditional bad companion was narrating a story when there was a pregnant woman who went into labor late at night, and the woman was placed on a donkey cart to get to the main road so she could get to the health facility to deliver. Now, on the way to the main hospital, main road, ambushed by wolves, crisscrossing their path. Out of fear, justifiable fear, they had to go back home, and the woman delivered at home. In the same area, a similar thing, this time a horse cart, a pregnant woman, and they were again ambushed by wolves. And then the horse itself was so afraid that he started running at full speed with the pregnant woman on the horse cart until they reached the main road. Then the horse slowed down. These had been the realities. And the president said this is not acceptable. People living anywhere in this country are Gambians, and we as a government need to do something for them. And that is what made him full of this country. And I think it's a remarkable effort. He needs a big round of applause. These community ambulances, there are 80 of them, and the way they are supposed to function, they will stay in the communities, and there will be a unique number 116 that people in the community and the community health officials, the village health workers will have those numbers, and people could call when they have an emergency, a toll-free number that they are going to use and no one is going to pay, even if they do not have any credit on their phones. And this ambulance will go all the way to their home to pick the pregnant woman in labor or the very sick person all the way to a health facility. I think it has never happened in the history of this country. So this is history in the making, and this has not happened in many countries that I know of in the whole of Africa. This is the first time in the history of many countries for such a thing to happen, and I think it's remarkable. The procurement process started sometime last year, and we had received a number of batches from UNOPS. Before today, we had received 55. The delivery had been delayed because of a number of factors, and one of which we were told was because of the global shipping challenges that was caused by the COVID-19 pandemic. So the people, the permanent secretary and UNOPS have been under a lot of pressure to make sure that these are delivered. I personally made sure that we followed up regularly, and we are happy. We thank the Almighty Allah for making this possible. Today we received the last 25, making the total number of community ambulances in this country to 80 ambulances. And this is remarkable because in the past 2 years, these 80 community ambulances and the state-of-the-art COVID-19 ambulances, which are 10, has made the total number of ambulances, new ambulances in this country to become 90. Before the arrival of these ambulances, the country did not have much more than 60 ambulances. And up to 45 of those ambulances do not belong to the government. They belong to Riders for Health. So the government itself didn't have up to 20 ambulances. But now we have brought in 90 ambulances, and I think the government of the day, the government of His Excellency, is putting the health of the people of this country first. At this point, as I wrap up, I thank His Excellency for the immense foresight, for the support, for the initiative, for the good leadership, for the exemplary leadership, for thinking of this and making sure that we are able to do so. We equally thank the National Assembly for their support, because when we went to the National Assembly for the supplementary appropriation for us to be able to procure this ambulance, there was overwhelming support. We thank UNOPS for all their efforts, paying attention to details to make sure that these ambulances get here, and for their patience, because we put a lot of pressure on them. We told them that the delivery time that you told us is due and you need to deliver. And they also were running around to ensure that this was done. And you can see the quality of ambulances we are receiving here today. These are not just ordinary ambulances. These are 4x4 desert type of ambulances that are robust and they are ready for the task. So we thank them. We sincerely thank the permanent secretary and his team as well for all the coordination, for all the hard work, for making sure that whoever needed to do whatever they did, they were able to do so. And the entire Ministry of Health team, Mr. Njai and his team, the logistic team, Mr. Sabali, the procurement team, Mr. Jawo, and the Directorate of Health Services, and all the people who contributed for this immense success. We thank the CFAO for their participation in this entire process, because we know getting vehicles is just one part of it, but maintaining those vehicles and making sure that they serve the people of this country for the duration that they are expected to serve plays a very important role in the overall process. And they have started already providing those kind of services. And we also urge them and encourage them to see this as a national responsibility, because what we say is this is nation building, and they have a big role to contribute to the building of the Gambia we want. So we have started. The people of this country are aware that the government of His Excellency has started the march towards the Gambia we want. Inshallah, we will get to the Gambia we want very soon. To the people who have been promised these ambulances in the various communities, who have been waiting, we wish to inform them that the ambulances have arrived and distribution will start today, inshallah, and then they'll be receiving their ambulances today. So we march towards the Gambia we want. At this juncture, I thank the ladies and gentlemen of the media who are always there, who have been there from the beginning. They are always there, come rain, come shine. They're always there together with us. It's a partnership for national development, and we wish to tell you that we appreciate your efforts, and your efforts are appreciated by the people of this country, and they are contributing a lot to the development of this country. So keep it up. Once again, I wish to thank you very much for your kind attention. Thank you.
I also want to say thank you to all of you for coming. The Director of National Medical Services, the procurement team, Deputy Director of Health Services, the Permanent Secretary, Honorable Minister, the entire team of CFO. We want to thank all of you for coming, and also CFO for giving us this very beautiful place to stand to give our statements. So we want to thank all of you. If you want to have the side interviews with the Honorable Minister in local languages, we'll also allow you just for 5 minutes, because it's also on his journey. I know, Binta, you are eager to have an interview with him. And likewise, N24, so you can have a joint interview with him in local language, Mandinka and Wolof, and then he can depart for his side. Thank you very much. Thank you. Now, yeah.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland, and the rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's money transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.